We're about 8 weeks or so into this pandemic. There have been stay-at-home orders and other measures that people have taken to minimize the spread of COVID-19. Are we as a society where you'd like to be at this point?
From a public health and scientific perspective, no. What we would like to see before we begin reopening the country or the state would be a sustained drop in the number of cases over about a 2 week period. And we're not there yet. Cases in Arizona continue to rise in particular. And so that's very concerning now that we're going to emerge really in the midst of the pandemic versus a time when we're on the other side of the curve and the numbers of cases and deaths are beginning to drop.
Why, after the stay-at-home orders and social distancing, have the numbers not been where you'd like to see them at this point?
It really comes down to compliance. And so maybe 50% of the state is doing a very good job with the stay at home and social distancing, but there are always those that don't think the virus is a big deal to them or that they're not susceptible. And so there is continued interaction that is resulting in new cases every day.
As certain segments of society, industries begin to reopen their doors, there are some best practices that we're being encouraged to follow, things from the Centers for Disease Control, like face masks. What are some of the things that we need to consider? Because there are still those who won't wear one or don't think they need to because they're not at risk.
Right. And this is going to be the battle and the problem going forward. The real risk in not adhering to social distancing or the use of masks is going to be that this month of staying at home is going to all be for naught, and we're going to lose the gains that we've made during this month. And so going forward and thinking about going into life, I think one thing that encourages me is that a large segment of our population has really permanently changed their behavior. And so whether the state officially opens or not, people are still going to sort of really practice strong social distancing that's going to help us maintain our gains. And what I'll be doing and advise people I know to do is to really keep very diligent attention to the social distancing, keeping 6 feet distance between you and other people when you're out. And hand washing is really 98% of our battle against this virus. It's an envelope virus. It's very susceptible to soaps and detergents, and it really can't travel long distances between people to transmit if people aren't coughing or sneezing. And so that 6 foot distance is really adequate to protect people. The masks give us an extra layer of protection in reducing the ability of the virus or the distance the virus can shed to even less than that 6 foot distance.
Given that we are here in the summer months, does that give you some hope that that heat will help tamp down this virus?
It may help a lot, but a seasonality component to this pandemic has not yet been observed. So it's not going to give us a lot of safety. And I think the real worry, though, that we have to be attuned to is come fall, whether the virus ramps up to a greater level or not, what's really going to be dangerous is that it's going to be coupled with a flu season. And so COVID-19 plus flu, either together or in successive infections, is going to present a really dangerous situation.
Is everyone still considered vulnerable, or are there age groups that are more susceptible than others?
Certainly, the group at highest susceptibility for infection is the elderly above the age of 80, but anyone above the age of 65, especially those with pre-existing conditions, have greater vulnerability to the infection. However, what we're beginning to see is that at lower risk is really everybody, even young children, which we used to think were not very susceptible, to people in the 20 to 50-year-old age range also can get severe disease. It just happens at a lower incidence than in the elderly population or people who are immunocompromised or have other pre-existing conditions that make them more susceptible to a respiratory virus.
Okay, Dr. Felicia Goodrum, a virologist with the University of Arizona. Thanks for your time.
Thanks, Lorraine.